Hello and welcome to Tinnitus Matters, the podcast where we talk about all things related to tinnitus. I'm Phil Holmes.
I'm Christine Nixon, and today we have a very special guest, Emily Halliwell, who is a clinical scientist in audiology at Lancashire Teaching Hospitals NHS Trust. Welcome, Emily.
Welcome.
Thanks for joining.
Thank you.
And thank you very much for taking the time out of your busy schedule, because we know how busy you guys are with clinics and things like that. So we really do appreciate you coming and having a chat to us about balance and tinnitus. So without further ado, I think we should jump straight in. So,
Fantastic.
are there any underlying causes that can link tinnitus with balance disorders?
Yes, tinnitus and balance are linked in several different conditions. They can occur separately as well.
Right.
The thing that links them is the fact that they can be generated from the auditory system, so the ear. So the inner ear, the bit that's deep down in your skull, where all the signals from the ear get to, you've got a hearing part and a balance part.
Right.
So your cochlea and your vestibular organ, and they're physically linked, and they share the same nerve that goes up to the brain. So there can be conditions that affect both or that affect differently, separately.
That's interesting.
It's interesting. How common is it with your patients you see then? How many that have balance have tinnitus, roughly?
I wouldn't be able to put a number on it, but as you know, tinnitus is very common, balance problems are very common, dizziness is very common. So it does co-occur a lot.
A large proportion.
How often they're linked isn't so clear, and sometimes they can be separate conditions, but treating one can help the other, just because of the stress link that links them both can exacerbate them both.
Because they are physically linked.
They're physically linked and they're both exacerbated by stress.
So how do conditions like Meniere's disease or vestibular disorders, sorry, I'm not very good with the terminology, how can they influence both hearing and balance?
So there are lots of different conditions that I'll see in a vestibular clinic. Some can be purely dizziness and balance related, so just affecting the vestibular organ or the pathways that go from there up to the nerve in the brain. Things like vestibular neuritis are really common, and that's when there's often viral, some kind of infection that's inflamed the nerve that goes from the vestibular organ. Labyrinthitis is similar, so again an infection that's inflamed usually the actual balance organ itself, not just the nerve. Labyrinthitis then, the one that's not just the nerve but also affects the balance organ itself, because that's physically linked with the cochlea, the hearing organ, they can both be affected, and then you get dizziness and tinnitus as part of the condition.
Wow.
It's very complex, isn't it?
And hearing loss as well. Yeah.
And how long could labyrinthitis last?
It does vary, and the time frames of all these conditions are actually most of the way that we diagnose them. So it's not momentary, that's other conditions. It's something that will be lasting hours to days, so quite often about 3-5 days. Can take a couple of weeks to get over the vertigo, this room-moving dizziness itself. And if it's labyrinthitis with the tinnitus with that, or if it's vestibular neuritis, maybe no tinnitus, but the dizziness will be lasting hours, days, weeks, and then gradually over those weeks it'll improve in most people as something called central compensation happens.
Okay.
So that's when the brain is actually dealing with the problem, changing the signals and resolving the problem itself. So it can happen naturally and fully self-resolve, and some people never need to see a medic about it. Most people do, because it's so frightening to get such room-spinning dizziness.
Imagine, yeah.
And some people are just maybe seen on the phone, told it's probably an ear infection, told to stay in bed until they recover and it'll go away on its own. And in some cases that does happen. In other cases, most of the time we don't actually know why. Everyone's bodies are so different, everyone's brains are so different, but for some people, some reason, it doesn't self-resolve. and they carry on with either a chronic low-level dizziness or spells of dizziness. So,
And how do you? So if that was the case, if somebody had that labyrinthitis with the tinnitus, they come and see you, and there's no kind of natural resolve. How would you treat them, or how would you help them?
so first of all, we'd do assessments on their ear system,
Yeah.
hearing tests, balance tests, and come to confirm the diagnosis that way. I think that's quite important because the treatment itself can be something called vestibular rehabilitation. But if you try this vestibular rehabilitation exercises to help treat it without the explanation of what's going on, it's often not successful. So
Right.
starting with a test battery, starting with education can really help be the reason how it's cured.
So sorry, Emily, going back to our other podcasts, Phil, knowledge is power again.
Knowledge is power.
Yes, and in helping the patient, the individual, overcome their symptoms is a big part then, is what you're saying, Emily.
Yeah, I've heard someone call it cognitive closure, just
Mm,
understanding what's wrong with you
like
That's
that.
an interesting term, isn't it?
can really help both
Mm.
conditions, dizziness and tinnitus.
So where we've got something, sorry, earlier episodes of the Tinnitus Matters podcast, we've been talking about tinnitus, what it is, how we have it. We've had some excellent guests and
Yeah.
consultants and people who experience it in. So I think at this point through the series, we're okay with certain types of tinnitus that we understand will never go away. But what we're saying here is there are some conditions like labyrinthitis or something where somebody could be experiencing balance issues and tinnitus, but because that's something else causing that, once that resolves, the tinnitus goes away, or will that stay?
It can be either, and
Oh, right.
sometimes you just
Yeah.
don't know.
Okay.
So again, if it's something that's persistent, that's when I would refer to someone like Christine for treating the tinnitus as a separate thing. But it's important to get the diagnosis because treating the vestibular condition, the balance condition, can be the treatment for tinnitus itself. So I'd
Yes.
see by getting that diagnosis, you can actually see whether treatments for that diagnosis can help before you need to deal with tinnitus more long term.
And if somebody came to, or if somebody experiences labyrinthitis, let's say, I keep saying that one because that's the one that was the example. If it does kind of self-cure, are they likely to get it again?
Yes, that's
Is it
good
going to be a recurring thing, or does labyrinthitis just, you have it once and that's that, or?
Is it episodic?
It's not usually episodic, but you can get it what you call decompensation. So there's some damage there caused by the original problem. And although you've compensated to it, your brain's made these adjustments to help you with the symptoms, you're compensated sometimes fully and you don't get the symptoms back again. Other times, if there's another stress on the system, if you're stressed or tired even, otherwise ill, your symptoms can flare up again and it's often not as bad as the first time. And that's actually what's part of the diagnostic criteria of it, that the first episode is the worst one and the following episodes might be decompensation, not as bad, but triggered by things that have made you reactive to it again.
Like the stress and the tiredness?
Yeah.
Or having a cold or a
Yeah.
virus or something?
Yeah. Basically anything that puts stress on your body.
On your body.
So you say there, I'm really interested in the compensation, and that's where your brain starts to compensate, and then, as I think you said before, fixes itself. Is there anything that somebody could do to kind of speed that process up or help that along? Or are there any exercises or anything that we could do?
Self-help
Yeah.
at home, really, isn't
Yeah.
it? That would be good, yeah.
So first of all, knowing that it's not a dangerous condition, that can be
When
part
you
of the
say
resolution.
dangerous, do you mean?
So not something that's life-threatening, not something that your body has to have this stress response to that might make it worse. So once you understand your condition, then it's looking into treatments. So the treatments, like vestibular rehabilitation, are quite often actually provoking mild level of the symptoms. So vestibular rehabilitation, balance rehab. You give patients exercises to do themselves at home. And the key to it is finding exercises that are mildly provoking, doing them really regularly. So you're trying to basically rewire the connections and provoke them and desensitize to them. There's a few different mechanisms of vestibular rehabilitation.
So the patient needs to feel a little bit uncomfortable when they're doing the exercises.
That's where a professional's help can come in to not provoke it too much. A bit like practicing anything, you need to practice at a mildly challenging level to get better at it. If you go, the patients that want to do really well and get better faster and try really hard end up making themselves worse, going too fast, over-provoking themselves and making the symptoms worse. So it's a very fine line of just getting the symptoms provoked to the
which is quite frustrating
yeah.
for the patient, isn't it? If they think they're doing their best, trying to get better, but it's almost overcompensation, is it?
Yeah.
And it's a it's a hard
So it
balance.
usually takes at least 6 to 8 weeks for vestibular rehab to start being effective. So although that can be frustrating for the patients, actually it can also be reassuring that this isn't just
overnight.
Yeah, there's a reason for it. You're rewiring these connections and it does take time. But that's reassuring in a way that we understand the pathways and we know that they are evidence-based treatments.
So in some situations, by doing the exercises, as you call them, vestibular rehabilitation and balance rehabilitation, it can help reduce the tinnitus because it's linked with the balance side at this in those cases.
It's never very straightforward, but potentially as you treat the balance problem, the tinnitus problem can also be treated. The most common reason that would happen is when the tinnitus is exacerbated by stress, and you're treating that by your vestibular rehabilitation and other grounding techniques around the exercises themselves to help with the rehab. They can help both the balance and the tinnitus. There's conditions like Meniere's disease. So in that case, it's slightly different from...
What is Meniere's
I was
disease?
just going to say,
So it's slightly different from a viral infection.
Okay.
And it's not very well understood, actually. But the endolymph, the fluid inside the hearing organ and the balance organ, one of the fluids in there, is what we call hydropic. So it gets to a level that can put pressure on the system and physically damage the little sensory hair cells inside those organs.
Lasting damage.
So initially it's episodic.
Right.
And again, coming back to how you diagnose these things, taking the history, the timings of what's happening.
Yeah.
Meniere's is usually about hour-long episodes of vertigo, of dizziness.
Right.
And to diagnose that, it has to fit certain criteria. One of the criteria is that it fits also vestibular problems with tinnitus, with hearing loss, and the time linked. So the episode, you'll get this problem in the ear that flares up. It causes vertigo, it causes tinnitus, it causes a pressure sensation and hearing loss. And that's as all that fluid is becoming disrupted.
Sorry, Christine.
It's so interesting.
I know, yeah, we're all diving in on questions. It's so interesting.
So, Emily, when you said to me that is really episodic, the tinnitus is only during that intense episode of symptoms.
It does vary. Some people can get it more constantly, but that tends to be in a typical case, which often you don't get.
Yeah.
The tinnitus would be episodic with the dizziness and can sometimes come as a warning that the dizziness is about to happen, a pressure feeling, a tinnitus, and then the dizziness.
Okay.
But what happens with Meniere's disease is that as this flare-up keeps happening, you're getting these, say, hour-long episodes that repeat quite randomly, so can be really quite difficult to manage for the patient. They can come out of the blue.
And do they increase in frequency?
Not always. They can do.
Right, okay.
It's very
when
difficult
you say
to say.
they come out the blue, could that be stress though again and virus?
There's
or is it
lots of
not?
thoughts behind it that
Right.
it could be exacerbated by stress, but not particularly the cause itself.
Right, okay.
And so with Meniere's, it's actually damaging these little sensitive structures inside the balance organ and the hearing organ. And the low frequencies are often affected first. So that's why you'll then see a low frequency hearing loss. The little hair cells in the part of the cochlea that are sensitive to low frequency sounds
Sorry,
will get the damage first.
so Chris was saying, wasn't he, that with age-related hearing loss, the high frequency cells get damaged first, but you're saying, whoops, it's the opposite here, the low, which is quite unusual, isn't it? So you're then able to know it's Meniere's from the hearing test?
The problem is because it's episodic, they might come in to see us and the hearing's
Oh, yes, of
improved
course.
when they're not in an
Yeah.
episode.
That makes sense.
But then if we're watching it over time, we can sometimes catch it during an episode or near to an episode when it hasn't recovered, or again over time when it's more permanently damaged and the hearing loss remains and the tinnitus might remain. So it's something that you have to watch over time to be able to fully diagnose it. And this interesting thing about Meniere's is that there are surgical options and there are medication options. So that's often not the case with tinnitus and balance, but with some things like Meniere's, very patient specific, so not everyone, but sometimes medication and surgical options can be the best way to treat it.
That's quite...
It's so fascinating that, that tinnitus goes hand in hand with that. And if we treat the Meniere's disease, the tinnitus can subside. And
for those patients, I know, like you say, it's only in some cases, but there is some hope.
Yes.
And that's great that if you're under that umbrella, it can't be pleasant. Obviously, those symptoms sound pretty profound. But if there can be some alleviation of the symptoms through hope of surgery or medication, that's a first for tinnitus within the other kinds of tinnitus, isn't it?
Very much so.
And that's where your multidisciplinary team working really comes in, talking to ENT consultants about what impact they can have, what they would recommend. So quite often with a Meniere's patient, I won't try rehab. I'll give them the education about rehab, but the vestibular rehab itself, take-home exercises, won't prevent an attack happening. That's where the consultants can help.
With medication?
With surgical treatments, over to them with that one. But we can then help with rehab, either advice on what to do to recover faster from an episode, if they want to try some rehab not at the immediate onset of the episode, but to recover from it faster afterwards. Or later, if it's become more of a chronic condition, that's when vestibular rehab can help. Or sometimes if the extreme treatments for Meniere's can be destructive surgeries, so actually destroying the balance organ, so it can no longer fluctuate, but then you start from scratch with your vestibular rehab and you're no longer dealing with a moving target of something coming and going. You're working with a worse system in one way, but at least it's a stable system. So it's all very, very patient specific and needs a lot of talk between different professionals.
And how rare is that, or is it not as rare as you think?
Not as rare as you think to me, because I see it in the clinic, so I'm a bit of a skewed person to ask, but I don't know the numbers of it, but it's something we do see in clinic.
So just if anybody's listening to this podcast or watching the podcast, if they have never come across any of these balance and tinnitus issues before, and suddenly they think, my balance is off, I've got this ringing in my ears, what's your advice that they do? Is it GP first?
Yeah, you'd always want to see your GP first, because they can check for any conditions that can be treated there and then, or any that need to be referred on, because they could be more dangerous conditions. Things that are medical emergencies can actually present as dizziness, things like a stroke, because that could be a blood supply cut off to your vestibular organ and give you dizziness in the same way that an acute ear infection would give you dizziness. But a medic or audiologist can know the signs that differentiate between when it's a more urgent problem and when it's an ear infection.
Right. And
so
then,
always a medic.
okay. So if the GP then refers the patient, where do they get referred to? Is it ENT? Is it audiology? Is it yourself? Is it?
It really depends on the local area. So we've started at our hospital trust doing direct referrals from GPs so that people aren't waiting so long to see an ENT consultant.
That's good.
Who would be then referring to us ultimately anyway for the advice and the testing.
So it's just jumping a little bit, I suppose, to make it speedier. And they're not missing a vital bit, are they?
So we are linked with the ENT department, and we can refer straight back to the ENT department if we're worried about anything, or if we need advice on maybe not worried but want the ENT input on treatment options.
So that's the same as the direct referral tinnitus clinic, isn't it, that the hospital offers as well to patients if they see the GP? They can get referred. So these pathways.
So that's speeding things up for the patients, isn't it?
Mm.
That's excellent. So people are getting seen faster and getting the answers with the specialists like yourselves sooner. But
not compromising, I suppose, on professional input from the doctors in ENT.
Well, if you're all kind of linked as a department, it makes it communication easier between. I think your phrase before was it. I might have missed it. Multidisciplinary team.
Sorry, that's a natural phrase for me. I love that one. Just working with everybody.
And isn't that brilliant? And you know that you guys are all under the same roof and you're all next to each other, and it makes that communication easier.
I think in health, it's really a you've got me on it now.
Sorry,
Phil.
I started.
Multidisciplinary team is vital, isn't it? And we promote it heavily.
And although I did say audiologists and medics first, then maybe to audiologists, ENT, there's some areas are really based in physiotherapy who are running these vestibular rehabilitation pathways, and they can refer back into ENT as well. So it does very much depend on your area, who the professional is, but someone who has a vestibular specialism, so inner ear balance organ specialism.
Brilliant. Again, Christine, I've learned so much.
Fascinating, Emily.
The fact that the balance and the tinnitus and the balance are so linked, and how the physical connection in the inner ear and all of everything that I've just learned so much about labyrinthitis as well.
And just knowing all these things is vital to the recovery, like we keep saying. The knowledge and the education is vital to part of the recovery. So absolutely fantastic, Emily. Thank you so much for coming on today to talk to us about it.
We really do appreciate it. Thank you very much. And we know you've got to get back to the hospital and back to your clinics. And we won't keep you any longer, but we really do appreciate it. I know the people listening to this podcast
will get a lot
out of it as well. So thank you very much indeed. And we'll hope to see you soon.
Thank you.
Thank you, Emily.